Welcome to video 2 in our regional circulations lesson. In this video we're going to talk about some of the special characteristics of the pulmonary circulation. Fairly important, I think you would all agree. The first thing to note, as I said in the last video, that the pulmonary circulation is in series with the heart. For the most part, the entire cardiac output from the right side enters the lungs, and the entire output from the lungs enters the left heart. These are in series with one another, okay? However, you will note that the pressures are lower in the pulmonary system. They're about 1/7 of the systemic pressures, okay? That should make some sense to you. You don't really, first of all, that's because the vessels are really compliant. Second of all, you don't really want high pressure in the capillaries in your lungs. You guys know now that when we talk about what happens with water in capillaries, you talk about filtration, where water is shoved out of the capillary by hydrostatic pressure. And you talk about reabsorption, where water is pulled back in by the osmotic gradient. You said there's an oncotic pressure there. Okay? So, if you think about the tissue in my legs, lots of skeletal muscle there, lots of interstitial fluid. When you think about the lungs as a tissue, what's there? It's mostly air, man. And you don't want to be shoving a lot of fluid out through filtration into a tissue that is basically the air pressure. Okay? So the hydrostatic pressure is reasonably low because in order to prevent excess filtration, if nothing else. Okay? Note that the exchange surface of the capillaries in the lung has to be very high. The exchange barrier must be very low. So this would maximize the rate at which you absorb oxygen, the rate at which oxygen diffuses from the alveoli into the capillaries. In order for that diffusion to be effective, you guys know from Fick's law that the distance of diffusion has to be as low as possible. The exchange surface must be as high as possible, and that is true in the lungs. Notice that the exchange surface is so thin, you can actually see the outline of a red blood cell here through the capillary wall. So that's how thin the wall is there in order to maximize the rate at which you can pick up oxygen. We'll talk a lot more about that in the pulmonary lessons in the vital gases course. Okay, so this is a diagram of the lung. This is the pulmonary artery, the pulmonary vein, and you are perfusing blood to the apex of the lung and the base, as well as the midsection of the lung. So that's A, B, and C. All right. So notice that the delta P, that is the pressure difference between the two here on the level of the heart, is 10. 15 perfusing in, 5 in the venous pressure coming out. All right. Now, and also notice that gravity has an effect upon blood flow in the lungs. So when I'm standing up here like this, just like when we talk about the systemic circulation where columns of blood are pushing down on your feet, they're also pushing down on the base of your lungs, okay? And you will note that gravity has an effect on the pulmonary circulation in part because the vessel walls here are very compliant. They stretch easy. So as those columns of blood push down, the pressure increases at the base of your lungs, and as that pressure increases, the volume increases because it's easy to blow up those vessels. They're compliant. The walls are compliant. So we have high capillary pressure at the base of the lungs because columns of blood are pushing down. We have low pressure at the apex of the lung because the vasculature is above the heart, and so the pressure would be less in that area, okay? So that means that we have a relatively high transmural pressure here and a relatively low transmural pressure here. That is the pressure across the walls. We have a high hydrostatic pressure here, a low hydrostatic pressure here. You can see that. We went from 15 to 5, we went from 15 to 25 on the arterial end. All right? So what that means is that the resistance to flow at the bottom of the lungs is lower than at the top of the lungs. The resistance is lower in the base of the lungs than it is the apex. The reason is because the diameter increases as the pressure increases and as you stretch those walls. And as you know, an increased radius means a decreased resistance to flow. The same thing is true on at the apex. The radius is down up here because the pressure is down up here, the distending pressure. And so the lower the radius, the higher the resistance to flow. So we have high resistance to flow here, low resistance to flow here. And that creates a difference in the circulatory and the circulation in those regions. The base gets more blood flow, has higher flow. You will also, and I'll bring that back in a minute, also note that within the lungs we have hypoxic vasoconstriction. This is different from the systemic circulation where, for instance, in my skeletal muscle, if I go hypoxic and CO2 accumulates and lactic acid accumulates, I get vasodilation. In your lungs, you actually get vasoconstriction with the fall in oxygen. And the reason is because if you have less oxygen in a region of your lungs, your body is smart enough to know that you don't want to perfuse those regions with blood. Because if you perfuse them with blood anyway, they're not going to pick up oxygen. Instead, you constrict those areas and you divert that blood to other areas of the lungs, which do have oxygen, to make sure that as much oxygen picks up, as much blood picks up oxygen as possible. So in the lungs, you constrict to hypoxic regions. In the systemic circulation, you dilate to make sure those regions get more blood. Okay, so it's sort of the opposite. All right, so let's take a look at our congestive heart failure patient with our dilated cardiomyopathy. Her respiratory rate 28 and labored. She's having a hard time breathing. She notes that she's awakening suddenly with the sensation that she can't catch her breath. She's coughing, and if she sits upright, the sensation goes away and she gets better. And she now has to prop herself up on pillows in order to get to sleep at night, in order to make sure that she's upright. Okay. She has crackles in her lungs, and notice that she is in heart failure. So let's see if she's in heart failure. Her central, we did this in an earlier lesson. Her central venous pressure is pretty high because what your body's trying to do is it's trying to increase filling pressure, to increase stroke volume, to try to get that cardiac output back up and try to maintain mean arterial pressure. So you've got a really high central venous pressure. Now, as you guys know, high central venous pressure, high venous pressure, that means high mid-capillary pressure. High mid-capillary pressure means more filtration relative to reabsorption in your capillaries. That means fluid accumulations in your tissues, and you get edema. She can't fit into her shoes. Okay? Similarly, edema takes place in the lungs. And this is called pulmonary hypertension, and you accumulate fluid in the lungs. This patient is sitting up. That fluid has accumulated in the base of her lungs, where, not coincidentally, first of all, the pressures are higher when you sit up because columns of blood are shutting down and the capillary pressure is higher. And gravity is also pulling the water down, and so it's accumulating in the base, and this keeps the upper sections of her lungs clear so that she can breathe. It's sacrificing the base of the lungs, but she's at least keeping some of the lungs clear. If she lies down, fluid accumulates and distributes throughout the lungs, and she can't breathe anywhere because there are no clear sections. So sitting up helps keep some of the lung clear. And there's less fluid in the lungs, and particularly there's less fluid in the regions here that are sort of in the upper end. Okay, so this is why you see fluid accumulation in the lungs. It's basically edema in the lungs. All right, And we have a low tissue pressure, which does not help. You know, you're full of air there, so that's going to, make it fairly easy to increase filtration relative to reabsorption. So, and that is exactly what I said. High capillary hydrostatic pressure at the base leads to more fluid accumulation and disease. In addition, you have gravity pulling that water down if you're sitting up. All right? All right. That's all I've got for this video. Thank you for your attention. We will move on when you're ready.